Hello, today we will be taking an alginate impression. So the contents and the equipment that you will need to be assembled prior to taking the alginate impression. So for today's activity, we will need, out of your bin, 2 bags, 2 rubber balls, the wider spatula, the alginate water measure, the alginate powder scoop, adhesive with a paintbrush or something to coat the inside of your tray with adhesive, a cup for your pre-procedural rinse. We have a selection of alginate trays. Trays come in a variety of shapes and sizes. They can be metal or plastic. The trays we use at Harper are disposable trays, and tray selection is a critical part of taking a good alginate impression. The other equipment that you will need is you will need your Dentecs to take your first alginate on your Dentec model. Some other equipment that may be useful for taking a good alginate impression include rope wax. This is used to help extend a tray. And all you do is you mold your wax around your tray. We have 50 milliliters of water measured out, which we are now going to put into a separate mixing bowl. We want to always make sure we incorporate the powder into the liquid, not the other way around. And here's our 2 scoops, and we're going to go ahead and just incorporate those in. You want to work efficiently. When you mix, you want to make sure you use the sides of the bowl to incorporate the alginate into the liquid. And the outcome that you want is a nice smooth mix. We are using a slower set alginate, but just for your information, it does come in very fast set, medium and fast set also. Then you're going to use the side of your spatula to gather all of the alginate from the bottom of the bowl. And this is about the consistency that you want to look for. Then what we want to do is take our finger, and I'm going to go ahead and do the upper one today as a demonstration. And we want to apply alginate onto the teeth. And just set that down. And now we're going to take our tray that already has the adhesive in, and we're going to load it up . I find it easier to separate the tray out into 2 and start. We don't want to overfill the tray, but we want to ensure that we have enough alginate . Smooth it out. And you could just set this to the side. The priority needs to be now getting this tray seated. And what we're going to do is just seat centering over the 2 centrals. And that's how we're going to take our first impression. While we're letting the alginate set up, this is a good time for us to start our cleanup. We can go ahead and remove all the alginate off of our spatula. And the alginate that's left inside the bowl gives us an opportunity to see, first of all, how it's setting up, because the alginate inside the bowl is going to set up quicker than within a patient's mouth. We want to let this set up and then just use our spatula. We want to use our spatula to encourage the set up alginate away from the sides of the bowl. And clean up our bowls. We want to make sure that we're not flushing any alginate or plaster stone into the sink, but that we dispense of this into the garbage. And then we can take a paper towel and wipe out our bowl. So here is our impression, and what we want to do is always ensure that it is set up by checking prior to removing. And then what we want to do is just gently pry away the alginate.
And then we want to take the alginate out without removing any patient teeth or teeth out of your Dentec. And Mr. Schwepke, as the prankster, gave me the wrong Dentec. So these teeth actually will just come right out. But I've never had this happen with a patient, ever. Trust me. And then this is how the alginate will look. It is a imprint of the patient's, or a replica of the patient's teeth and soft tissue, actually. And after we've removed this, we are going to wrap it. We're going to disinfect it. And how we disinfect it is we spray it and then we take a moistened paper towel, moistened with water, and I usually just spray a little onto the paper towel. We wrap it and we place it inside this plastic bag, making sure we remove any air and seal it tightly to make sure that we keep the moisture inside that alginate until we're ready to pour that alginate out. We would repeat that procedure for the lower tray also. If this was a patient, we probably would go ahead and write our patient name right on our bag.